my wife Bina Shah. She had a problem of fatigue and little palpitation in year 2015. And when we consulted cardiologist, she was asked to take 2D echo. And in 2D echo, we found some regurgitation in aortic valve and little calcification was started in mitral valve. Being very mild, cardiologist took a decision to treat this with the medicine. And it all went well, but in 2018, palpitation increased, and on every year 2D echo check, ultimately it was found that both the valves are not functioning properly and there is a lot of mixing of pure and impure blood. So we need to replace both the valves. So both the valves were replaced in 2018 December at Saifi Hospital by Dr. Sripal Doshi. Everything went very well, everything was good. Then on every year checkup by 2D echo, again in 2021, there was a mild regurgitation and problem in mitral valve, which increased to a level was not acceptable in 2022. So it was needed to be replaced as soon as possible. Now earlier operation was done by open heart, and at the age of 69, reopen heart was very risky. Risk factor was 30 to 40%. We consulted 2-3 different cardiac surgeons, and they all suggested that you must go for TAVI. So with lot of research, we decided to look for, as it was planned, we wanted to look for the best of experienced person in interventional technology. We decided to go with Dr. Ravinder Singh Rao. And this entire procedure was done within 3 days here in Lilavati. And today we are taking a discharge. We are very happy with the procedure done by doctor, and result is extremely good, and heart started functioning to a perfect standard immediately. Now advantage of procedure is that you don't have to open the heart, you don't have to go on heart and lung machine, you don't have to park your heart on heart and lung machine. And after operation in open heart, you have to be careful for about 3 months, and there are so many other issues. Here on 4th day you are normal, and in 1 week's time you can go back to your normal activity. That is something, a fantastic technology in medicine, and we are very happy with the result.
TMVR stands for transcatheter mitral valve replacement, wherein we would replace the mitral valve by a catheter-based procedure. No open heart surgery, no scar, no incision on the chest. We would go from the groin vein inside the right side of the heart to the left side of the heart, and we'll put the new valve inside the old valve. The valve starts functioning immediately. Patient stays in ICU for just 1 day, and next 2 to 3 days these patients start walking and do their daily activities. This is a boon for patients who have already undergone one open heart surgery and the mitral valve has degenerated or it has started leaking again. Like in our patient Ms. Bina, who had 2 heart valves replaced in 2017, where both mitral and aortic valve were replaced surgically. The mitral valve has started leaking and patients started developing heart failure. A redo open heart surgery is high risk for such patients. We replace the valve without open heart surgery by doing a TMVR valve-in-valve. Now post-procedure, she is leading an active life, doing all her daily activities with no restriction. She goes out, walks, and does all her daily course with great energy. So it is a boon for patients who have already had one open heart surgery.
Dr. Ravinder Singh Rao, a man with terrific principles, a very perfect, very noble, very soft speaking, and explaining very well, giving a lot of time. In first visit, I had about 45 questions, which he replied all of them with full patience and very well correct answers, So I was fully satisfied that this is a doctor, he will definitely complete my procedure to the best of it. And it happened. Bina's procedure over in 3 days, and we are going home today.